How how active should the government be in should they have been with this COVID pandemic in the way that they handle it? How would you guys have liked to have seen it differently based on, say, like, for for you, Will, it would have been like a more government working with private industry response, but for you guys, Sana and Devin, more like a government response. What would you have liked to have seen, and how would that solution have laid itself out, from your perspective? Theo, we can start with you.
Okay, so um, I actually had quite a bit of family contract COVID-19 right out the gate, and that was pretty scary for me and my family. Worrying about my stepsister and then my nephews and my grandmother and all these relatives. But again, you turn on the TV or you go and Google, President or U.S. response to COVID-19, and there really wasn't anything at the beginning. Honestly, I didn't really see plans developed or being developed any direction, except shutting down the entire country pretty much as far as travel is concerned. And then you had the CDC come out with wear mask, and then what type of mask, and there really wasn't any guidance other than stay 6 feet away from the next person, wear a mask, if you're feeling sick, don't show up for work. Honestly, and I don't know where to even begin with it, because this is something we're all experiencing for the very first time, honestly, something to this magnitude that has affected the entire globe. So um, I don't know, maybe a little more initiative from the beginning as, okay, other countries are being affected. It's only going to be a matter of time before the U.S. experiences an outbreak. Here's what we have in plan. Here's how we'd like to start, our COVID-19 plan. This is the direction we're going. We didn't get anything like that. So I think starting off with something like that, especially from the White House or from state governments or the CDC, anything would have been better than what we experienced. So just having a plan and trying to initiate that plan from the beginning, anticipating the problem, would have been a big plus for me to see that from our government. But again, like I said, this is the first time we're all experiencing this. Hopefully we get through it, but that's all I can say, honestly.
Will, do you think the lockdowns were an overreach or have proved themselves to be an overreach?
Um, I wouldn't say it was kind of an overreach. I just think it was sort of a precaution. What I think our government should have done in regards to the outbreak and controlling it, I think the first thing they should have done was shut down international travel, because it was coming from Asia, from China, and they should have just shut down international travel to kind of slow the spread. Then I think the first things they should have done is kind of, okay, hey, let's take care of our Americans first. Let's get a plan going and, see the actual real numbers. Let's actually get some facts and some numbers in and see what we're working with. And let's get a plan and try to, get control of it. And I think that didn't really happen as we thought it would have went with the government, because the lack of bipartisanship that's in the government right now. So I think there's a lot of conflict between, I guess, Congress and the president's administration. I would just think, in my opinion, it's all kind of foolish, because you have a whole bunch of people that are susceptible from contracting the virus, and they have these pre-existing conditions that put them at high risk. And I know a lot of people that have gotten the virus. There's been people that have like diabetes or high blood pressure or heart issues. They're usually the ones that they're kind of in the hospital with the ventilator. So they're like there's a lot of families that are very scared. So I mean, I think the first and very the most important thing would be just taking care of the Americans first, and we'll figure out a plan later. Because I think, for me, in my opinion, and I could be wrong on this, and people can have their opinion about it, but I think China is just as responsible as any other country is handling their the outbreak and taking care of their citizens. And I think what they should have done at that point in time, when they noticed, like, okay, here's an outbreak, let's shut down the borders, and let's quarantine, and let's take care of this thing. So I think there needs to be a lot of bipartisanship when it comes to issues, especially of like a global pandemic, because these you're putting people's lives at risk. But I do think as far as as a precaution with the CDC saying wearing masks, socially distance, stuff like that. I think that's starting to work now. But people, I think the government also needs to understand, like, when you have stuff like this going on, like there's also negative effects that happen to people, like the suicide rate has gone up. um, there's another thing I read online that did research into drug abuse that's also went up. And I guess there's also other stuff that that could be beneficial, spending more time with family, and there's other stuff that you can look into. But I think the most important thing is, are we safe, or is there is this going to get any better? Like, people need to have that and be ensured that, okay, everything's going to be fine, we're going to fix this. So I think that's the most important thing. I think it's just the bipartisanship of both sides working together and letting the American people know that we're going to get through it. Then it's going to be as soon as possible. So
Definitely. Sana, do you kind of agree with the other two, and moving forward with, I think Biden or President-elect Biden had a couple of tweets saying that he was going to institute I think he said 4 to 6 week lockdown, I think is what he said. Um, going off what Will said about the negative effects of the lockdown as well, where do you think the trade-off is for that, and how would you like to see it handled moving forward?
Yeah, I mean, I think it's difficult to say really what a lockdown would have impact wise on individual citizens and the economy. So we saw a pretty big recession when we did go into lockdown, and a lot of businesses were shut down. I think it may be an overreach to completely shut down everything again. We know at this point what our vulnerable populations are, so we know that maybe they still should continue to stay home. But I think in terms of retail and restaurants, they're handling it in a lot of big cities really well, creating innovative ways to do curbside and eat outside and all that. So I think in terms of a lockdown, I think it's going to have a pretty negative effect. We already see seasonal depression year over year. I don't think, a lockdown during Christmas and preventing people from seeing their families is really going to help. But I do think they do need to really emphasize the importance of quarantining before you go see your family, or, if you can continue to get tested as much as you can to know if you've been infected, or if you're carrying any type of, if you're asymptomatic, if you're carrying the virus at all. But I mean, just to mimic off of what Will said, in terms of a communication plan, it was really lacking. I think if we were to look at when they knew, and if it really was January, we saw a first outbreak in Seattle and then Boston back in like February, and there was still really no communication on. So we're seeing this, it is mimicking kind of like a flu-like virus, but it is more deadly. Stay home if you can, or prevent travel if you can. I think that was just a really poor response. So if you look at previous years where we've had SARS outbreaks, China and other countries have been wearing the masks. So when you think about Americans just refusing to wear them outright, it's kind of ridiculous. Even if you didn't know it was working previously, to know it now and still not do it, kind of tough. So I hope I answered your question. I know I went kind of a roundabout way.
No.
It's just hard to kind of know what's going to work at this point, because it's been almost a year since we've all been in quarantine or in lockdown. So